Hello, I am Marwan Abourass. In this presentation, we embark on a journey through the 10 areas of diagnostic interest, beginning with ADI-1, the clinical crown. Radiographic analysis of the clinical crown is essential to all dental disciplines, not just endodontics. However, since endodontics is the focus of this presentation, we start with every treatment where every treatment began, the clinical crown. The crown is the most exposed part of the tooth. It's the area most prone to disease, trauma, wear, and repeated restorative interventions. It's the area most frequently examined and manipulated by clinicians. From my perspective, radiographic analysis of the clinical crown must always be the first diagnostic checkpoint, the first, which is why it appears as ADI-1 in the 4-hour operational diagnosis protocol and, of course, the 10 ADI protocol. It's a whole section of radiographic interpretation. This presentation has 3 objectives, each focused on a different condition of the clinical crown. First, we look at the intact teeth without restorations or crowns. Our focus here is on radiographic image of what? The most important item, the pulp chamber. Its size, its symmetry, its proximity to the restorations or to caries to the outside, and what it reveals about the biological status of the pulp. The pulp chamber is so central to diagnosis, my diagnosis, that I have dedicated a whole entire section, ADI-2, for the pulp chamber alone, so I'm not going to get too much into it. The second objective, we shift to teeth with intracoronal restorations, specifically those restored with composite, amalgams, etc. Here, we analyze centers of restorations, margins, their proximity to the pulp chamber, and the presence of absence of signs of calcification, pulp exposures, residual caries, these things. The third objective, we explore the most diagnostically challenging category, teeth with full coverage restorations. That's what I call a blind evaluation dilemma. Unlike direct restorations, full crowns obscure the actual tooth structure, leaving us to rely solely on radiographic cues. One of the most significant signs that I teach my students and I work with in my practice is to recognize a radiolucent halo around the crown margins. This halo, that's all I can see when we have crowns. And it's often is the tip of the iceberg, a clue pointing to recurrent caries, open margins beneath the crown. When I see that halo, I treat it as a clinical red flag. Absolutely, no compromise. And I will remove the crown. And I'll tell you, this from experience, I have never never removed a crown because of a suspicious radiograph and ever regretted it. I am always rewarded with something surprising which I did not expect. Something that confirms the radiograph was really trying to tell me something, but I didn't listen. These three categories, intact crown, intact intracoronal restorations, and crown teeth, form the basis of this presentation. We will explore each through clinical cases, okay, and I will discuss their radiographic appearance and consider the diagnostic implication. So now that I have outlined the objectives, let's begin with the first one. Imaging of the intact crown.